Hey everyone, welcome to Hump Day Happy Hour hosted by Dennis in the Know, the webcast where dentistry meets real talk, real news, and just the right amount of sarcasm. We are pulling back the curtain on the dental industry. We're talking to the experts, the innovators, and the everyday clinicians who are out there doing the work. There is no fluff, no filter, and definitely no sales pitches disguised as education. If it's happening in dentistry, from clinical insights to regulatory curveballs or the latest scandal at the American Dental Association, we are probably already talking about it. And yes, we are bringing the goods. So whether you're a seasoned doctor, part of a dental team, the industry, or just a curious consumer, maybe you're here for the banter. We welcome you all to the show because around here, we're not just in the loop, we are in the know. Hey there, I'm Dr. Jeff Horowitz, and I am with two of my favorite people in the world, two amazing clinicians and two great friends, Dr. Chad Duplantis and Dr. Jennifer Bell. We created this little platform to make the world just a little bit smaller and a lot more fun, particularly the dental world. Today, we have a fun topic that is really hopefully going to be helpful to a lot of you out there in the public who maybe are not totally convinced that you need to see the dentist every 6 months. Maybe you're wondering how often you should go, but we're going to tackle this topic tonight of how often the average patient, and I think that's going to really be where this goes, is that nobody is truly average. I could be guessing, but I have a feeling that's where the conversation is going to go. And I think everyone out there wants to understand how often they should be going, when they should be going, and let's boil that down. So, without further ado, I see Dr. Jennifer Bell on the screen. And what do you think, JB?
Well, I think actually, if it's okay, I'd love to default to Chad because I think he was really excited about sharing a story. I think that helps highlight this as an example.
I love a story.
Hey, wait a second. Can I talk?
Yeah, we're actually going to let you talk tonight.
I'm just curious because, when Jeff did his intro, which was fantastic, by the way, as always, Jeff. I mean,
Yeah, I agree.
as always. I like the glasses too, Jeff. They're better than the glasses you had on before. But
Yeah.
he said, I see Dr. Jennifer Bell there.
I know.
Because Jennifer was
I-
on my screen. We're
yeah,
on a different platform right
yeah,
now.
I don't appreciate that. Okay.
Okay.
I mean, I'm here too. I mean, do I need to raise my hand?
You
You
count.
won't see it.
Yeah, I
Okay.
couldn't see it. You weren't on
Yeah,
my screen.
you're going to need another tactic.
Wait, hold on a second. I think that you can raise your hand on the bottom there or something like that. But anyhow, so
Hey
so
guys, really quick, check out my glass. In
Oh.
case I get snarky tonight, it's just coming from the vibe.
Is that
nice.
Maud?
It is Maud, but in her Dorothy
B,
era.
yeah.
B.
Nice.
Arthur.
B. Arthur, yeah.
Yeah.
All
See,
right.
I'm going way back. I'm going
Yeah,
old
you
school
you
with
pulled
Maud.
Maud when everyone
Yeah.
else is thinking Golden Girls, but it's fine.
Yeah, Maud was angrier.
She was.
Yeah, yeah. So that's why I thought that.
So I'll tell this little story, and I think dentists would get it a lot quicker than the general public, and not because they're slow or anything, but just sometimes people don't understand how things work. So uh, we had a patient that went somehow they ended up at an implant surgeon. Okay. And an implant surgeon is, as we know, not usually a general dentist. This happened to be a periodontist who treats gum health and places implants and whatnot. And they had some gum surgery and had some implants placed. And the periodontist referred them to our office. It was kind of an emergency visit. And so patient had issues with the teeth, referred to the periodontist from the orthodontist. Periodontist places implants, and the patient decides that they, want to go to a new dentist to have the work done. So the periodontist sends the patient over to my office, and there were so many things that had happened prior to, but by the time the patient got to my office, they were missing all six of their front teeth. They had three implants placed, and we ended up just going through a process to go ahead and restore and replace this beautiful young lady's teeth. And so patient comes in and we worked on this lady through a lot of planning that should have been done prior, but it didn't go through the proper channels. Did a lot of planning, restored these teeth. The whole process took about 9 months from the time that they came over. And yes, they did have temporary teeth. They weren't going around, toothless for the whole 9 months. And at the end of the 9 month process, this young lady is sitting in our operatory, and she's got tears in her eyes. I've got tears in my eyes. My assistant's got tears in her eyes, and she's so happy with her new teeth. And she says to us, she says, "I think that I need a new dentist." And I said, "Okay." And I mean, I was kind of taken by that. I didn't quite get it. She says, I need a dentist because I'm supposed to go every 6 months, and I need somewhere that will do that. And I stopped and I said, "Did we do something wrong?" I said, I apologize, but we've been together for 9 months. Here we are. We're all happy with the end result." And she goes, "Oh, what do you mean? Did you do something wrong? I love my teeth." And I said, "Well, you can come see us every 6 months." And she goes, "You do that?" And I said, "Where do you think you've been for the past 9 months?" And she goes, "I thought I was at the guy that fixes implant problems. You mean you do more than that?" And I said, "Yeah, those first three rooms that you walked by, that's where we see you every 6 months." "Oh, well, then I'll just keep coming here."
Oh,
But you
I'll
know,
just
the
have that.
yeah, the thing was is that she didn't do anything wrong. She went to went through the different channels of orthodontist, periodontist, and the periodontist is like, "I'm going to send you to this guy that's going to fix these implants." She's like, "Okay." She never came through the proper channels into the office. She came and she saw me first. She didn't see the hygienist first, which is what most of our patients are accustomed to.
Right, right.
And she came in and she's like, "Hey, I need to see a dentist." Well, that's what we do. I mean, and it was the elation in her eyes, and it made me feel a hell of a lot better too, because I thought I had screwed something up over the
Yeah.
past 9 months.
I got a guy.
Hey, but I found it so fitting that we're talking about this tonight, and it's truly a question that we get a lot. How often do I need to come here? So I'll turn it back over to JB, which is where Jeff wanted it to be in the first place.
Well, I didn't want to be there. It was just her face was on my screen by default. So that's
Yeah,
why I
yeah,
went there.
yeah.
He
Yeah.
naturally defaults to be
Yeah,
anyway.
Sure,
exactly.
sure.
So what are your thoughts, JB?
As I've been thinking about this topic all day today, I think your first comment of everybody's not average, like there really is a customized approach to every single patient that walks in, because I've had patients who haven't been seen for 10 years and I knock off the big stuff and I give them a pat on the butt. Not really, but you know what I'm saying? And I'm like, "You look
I want
great.
to come to your office.
I'll see you in another decade."
Yeah.
Like, they just were gifted the dental lottery, and their diet, hygiene, genetics, and biochemistry are all working really nicely together. And they're actually able to maintain this, very healthy equilibrium. Uh, and then I have some patients that can't go 6 months without me identifying something that needs, some type of intervention, and they have won not the biochemistry, genetics, oral hygiene, and diet lottery, and things destabilize pretty quickly. And I think what has been very consistent over my time in practice is that the destabilization process happens without a lot of warning, and certainly happens unbeknownst to patients. I mean, there are many patients that come in who I inform them that there are a lot of things happening and nothing hurts and they feel fine. And I can see through the x-ray that things are really starting to change. And if we hadn't had that opportunity to have that discussion and they had gone on about business for some period of time, they would have prematurely lost teeth, or certainly have had to have root canals and a lot of other invasive and costly procedures to do that. So I think the challenge I struggle with, first off, let me just be an advocate for getting a good general dentist in your corner, because I really feel like a quarterback for my patients. I feel like I'm there as an on-call person, that when they need something, we're there. So when their kid falls on the skateboard, or they're, the first snow comes and they go sledding and they curb it and they need to call somebody to help. That's what we're here for. That's why you built that relationship, so that when you pick up that phone, you have somebody who can be your advocate and your quarterback to get you the right care. But the second thing is so that the dentist can establish that rate of rhythm for you. When patients come through the door, I can tell them whether or not they're a patient that needs x-rays every 6 months or they need x-rays every 4 years, because we're establishing the rate of disease and the rate of risk so that we can guide them through the best preventative care protocols. And I think we don't talk enough about the fact that dentists actually should be looking at patients and saying, not every size fits all. We don't have to take an x-ray every year. I have plenty of patients that are on a 3 or 4 month recare, 3 or 4 year frequency for the radiographs because they haven't had a cavity their entire life. And they're currently super healthy, no medications, no biochemical changes. I don't anticipate more cavities in the next couple of years, but always let them know if anything changes. You get diagnosed with a new disease, you start taking a bunch of new medications, you start chugging, as Chaz says, you start developing quite an affinity for Dr. Pepper, then maybe we need to, increase the frequency. But I think you have to establish that initial relationship with a dentist to find the right person first that's willing to walk that path with you, but then establishing what that frequency needs to be. And, we can't really go on here and say, yes, a patient needs to see a dentist every 6 months, because I wholeheartedly don't believe that every patient in my practice needs me every 6 months. But if I don't meet you and see you for the first time, I can't establish that recare frequency, that visibility frequency, and guide you through the right proper channels for preventative and intentional care throughout their life cycle in our practice. So that's my stance.
And I just want to, Jeff, I'm not trying to block you by any means, but I just have to say something, because you mentioned something earlier that we have the patient every 6 months that has something. And I can speak for the three of us, and I know wholeheartedly that I just want to say that for the three of us, when you have something every 6 months, that isn't a cha-ching, cha-ching, cha-ching.
Mm-mm.
That hurts us sometimes more than it hurts you, that patient that has something every 6 months. But that's what you need to look for in a dentist too, is that whether you need the deep cleaning, whether you need something every 6 months, you need to look for a dentist that when they tell you this and they're sharing this with you, that you can feel that compassion, that that almost like, I hate to say it, but I want a dentist that's almost like, hey, I hate to tell you this, because you know what? It pains me as much as it pains you, maybe even more. But this is what's going on. And the kicker is, and this is why. And it doesn't make us happy that you have something every 6 months. It really doesn't. So
So we like to be, we're all kind of naturally the heroes, right? We went into this because we want to help people, but we also have that little hidden piece of our brain that really wants to be the hero. I want you to like me. I want you to say, yes, I don't have anything, I prefer that experience. And frankly, what we do is so hard that doing it all day, every day is a little bit tiring. So getting, me walking in and giving you a good check is also a boost to me, because I'm like, yes, I don't have to do really hard invasive dentistry today. Like that's an
really
okay
is.
thing.
It really is.
So to add to that, I also think that for many patients, they don't necessarily realize that that we're really okay with patients that come in every 6 months or even once a year. If we tell them that's all they need to come in for, we are elated that they can do that and that they are spreading this message. I go to this guy or gal that has said, you know what, I don't have very many risk factors, and as of right now, it's okay to come in once a year. You can certainly come in more than that if you'd like for me to check anything or if anything's concerning you. But I think that the goodwill goes so much further, and they will tell so many people, hey, I go to a person that says, hey, here's what your risk factors are, and you have none right now. Now that could change, as JB said. Risk factors don't stay the same forever. Just because you have a low propensity for developing cavities doesn't mean that necessarily that you may not have an airway problem or that you may not develop gum disease. And we have to look at all of these things individually, but we do have some patients, as JB said, that come in and they just won the dental lottery and the medical lottery and the functional lottery, and they're just very lucky with their chemical biochemical makeup and with their immune system and many other factors. So, if we have that opportunity to deal with our patients, and this is what it goes back to, is being able to deal with each individual as an individual. And part of that is not just saying, how many times a year do I need to see the dentist? It's, a good general dentist is breaking that down into subcategories. If I'm your general dentist, I'm not just looking at your teeth. I'm not just looking at your gums. Every time you come in, I'm reassessing your medical risk. I'm reassessing how the jaw joint is working, how the teeth are functioning, how the biting and chewing is going, what the airway looks like. I'm looking at, we're doing an oral cancer screening, and the risk factors are going to be different for each of those individual systems. And so I think, a really good way to judge or to get confidence in the person that you're working with, the dentist, is to hear some of that, to say, well, listen, you're at high risk for cavities, but gosh, your gums are terrific. Your oral hygiene is great. It's to be able to say you're not just a dental loser. It's to say these are just your risk factors, and maybe you need to come more often for gum issues, but not necessarily tooth issues. You don't need x-rays quite as often. So it's really not just a matter of treating people as individuals, but also us breaking down our broad area of expertise into smaller areas and saying, I just want to make sure that we've covered risk factors for all of these different areas that I have to cover. And maybe we're not an expert in some of it, and maybe we make a referral for that just to get that assurance. But it all boils down to individuals' risk, not just the people, but the individual risk factors for any given patient.
And a couple of patient categories that I would like to highlight that I have seen are often tipping points in patients' lives where things seem to change.
Right.
The first would be in that teenager category when they start transitioning to more autonomy and more autonomous behaviors. So they may have been low caries risk or low cavity risk for a very long time, but it's always their first job. And it's their first job at Chick-fil-A, where they have unlimited access to the fountain machine, or, some change in lifestyle that had been very different from when they were a little bit more under the control of mom and dad. And we start to see a significant change in their cavity risk at that time interval. And that continues through college, because college is also stressful. So we have added immune challenges that are happening during college because of stress levels, because of environmental conditions, et cetera. But also, again, staying up late, drinking coffees and sodas, maybe an occasional beverage out at the bar that's slightly fruity. But it's all of these other new lifestyle things that might not have been happening when, mom and dad were more in control of what the child was consuming. So we do often see an uptick in cavity activity during that time period. It often requires kind of a reset and a lot of education to kind of redirect and recorrect and help younger patients, teenage patients, younger adults understand risk factors associated, because a lot of those conversations don't happen because they've gone along all this time cavity free, no issues. We don't need to talk about the risk factors of soda or sports drinks or, long-term sipping on beverages without, changing the pH and trying to drink tap water. All of those things, we don't need to talk about it because the cavity risk has been zero. And then all of a sudden we see the spike. So for anyone watching, if you fall in that category, that's definitely a category that we see the risk factors change a fair amount. And the other big category, two others. One is systemic disease change. So if you've been diagnosed with a major systemic disease, so it could be autoimmune diseases, cancers, a lot of other things that significantly change the number of medications you have to take, how you take care of yourself if you have a lot of long-term stays in the hospital, et cetera. We definitely see a change in risk profile that happens after that. So if you've been low cavity risk, low gum disease risk prior to that, having a dentist as part of the medical team to make sure that you can maintain that through treatment, maintain that through changes in medication is vitally important. And then the third category that is, for me, the most heartbreaking is it's the patient in the latter part of their years that has been, kind of trucking along in this pretty nice, normal pace. And then categorically, the disease process seems to change overnight. You look at a set of x-rays from 6 months ago, and then you look at them at their year interval, and now there's cavities, root cavities on every tooth around the head. And a lot of that has to do with systemic changes, salivary flow changes. Sometimes it's manual dexterity if they can even get into nooks and crannies. It's medications. It seems to be, and when it happens, it's quick, it's painless, and it's pretty catastrophic, frankly. When we see these patients come in, my heart actually just breaks apart because
we know we're fighting an uphill battle at that point.
There's not a great, I don't even know how I did that, but yay.
Yeah, I was thinking the same thing. Go for it. Yeah.
Oh,
high tech on us. Let's do this. I love what you've done here now that we're starting to, maybe for our listening and viewing audience, breaking down some of the risk factors that alert us. Why don't we do this? Why don't we go through each of the categories of or areas of dental practice that we kind of assess risk for, and then maybe each mention what some of the risk factors that we look for are. So, when we're talking to our audience, again, we always first want to evaluate the medical history, reevaluate the medical history. So let's start there. With regard to medical history, you mentioned a couple of them in the first things that you talked about. So certainly age has to be a concern. What we call xerostomia or dry mouth, lack of saliva, which can be caused, as Chad said, from many medications that are out there. Why don't we go around and say what some of the medical history risk factors are that would alert us that perhaps we need to see a patient more often or be more aware that they may be at higher caries risk or periodontal risk?
I'll say bisphosphonate therapy. So if a patient is taking medications to treat osteoporosis or bone density issues, those are often called Fosamax, Boniva. You're also seeing Zometa in some of the injectable forms as well. And then some cancer patients that are taking these medications very frequently, like multiple myeloma and metastatic breast cancer, they're taking bisphosphonate therapy on a very regular basis. And that medication is meant to slow the degradation of bone. And for cancer patients, it's meant to prohibit the ability for cancer cells to move into your long bones. But it works very differently in our face. And if we understand that 100% clearly yet, I'm not aware of it, but I think it does function. The medication functions very differently in the face. So For patients that are on those medications, I would prefer to see them more frequently because the biggest risk factor for them is surgical intervention. So if I have to take a tooth out or do some type of surgery to work on the gum tissue, bone tissue, etc., the risk for that tissue just not healing appropriately and leaving an open wound that is very difficult to solve is much, much higher. So preventative therapy becomes a lot more impactful. When I see something, I treat it. I'm much more aggressive with a treatment protocol because I can't watch and wait because I don't want the risk of losing the tooth to be potentially there. I'll even do a lot of interesting alternative therapies that you wouldn't normally do on a healthy patient to prevent surgical treatment when we know that that risk factor is there. So for me, one of the risk factors that I watch for in the health history is whether or not they're taking those types of bone medicines that help with bone density because it changes their long-term prognosis in the dental office.
Yeah. Chad, how about you?
I don't know that I really want to mention anything at this point in time because I want to piggyback on what JB said. You bring up a really valid point, JB. You talk about bisphosphonate therapy, and it's something that kind of came to light about 25 years ago. It was really hot when I was graduating dental school, and it kind of died down. But I'm noticing, since you bring that up, females in their 60s and 70s were noticing these rare lesions on the palate, so on the roof of their mouth. Um, and the only thing we can link them to, we've seen two within the past month, is bisphosphonate therapy. Zometa and crap, my brain is farting tonight. What was the other one? Boniva?
Fosamax or Boniva.
Boniva, yeah, Boniva and Zometa, and there were these really weird lesions, and they used to see, you don't see the commercials as much anymore, but you hear these commercials about rot jaw, and it was, they were horrible commercials. You don't see them anymore, but it still exists, and bisphosphonate therapy is real, and there's a lot of people that need it for osteoporosis, osteopenia, and whatnot. um, I think that's something that makes us really need to see these patients on a more frequent basis because we are seeing these strange lesions. And like I said, two within the past month that we've referred to in our area. I'm in Fort Worth, Texas, but in our area, UT Southwestern, who has an incredible oral surgery clinic, we've referred them there. But it's something that for post breast cancer patients who are on a lot of these, we need to see these patients in a higher frequency and make sure that they're not developing lesions that can be detrimental.
Mm-hmm.
So
How about you?
yeah, you would also agree that I mean I'm glad that you added to that because that is really a biggie for us. One of the ones that I was always very sensitive to was diabetes and pre-diabetics.
Absolutely.
Yeah. So with type 2 diabetes, you're going to have a harder time fighting infection to begin with. There's
And
compromised.
healing.
What's that?
And healing.
And healing.
Yeah.
Absolutely. So it really can alter our treatment plans. They're more susceptible to infection and poor healing from procedures that we do. We also know that there's, a higher propensity for sleep apnea when someone is diabetic. It's a very common comorbidity with obstructive sleep apnea, which obstructive sleep apnea, if left untreated, can create more inflammation, which can put their cardiovascular system at greater risk. But on the dental side of that, if they have obstructive sleep apnea, then they're also more likely to have gastroesophageal reflux, or GERD, as everyone knows it, acid reflux, particularly at night, which can make the mouth acidic and cause them to be more likely to have cavities. So we see a higher likelihood for periodontal disease. We see a higher likelihood even for caries if that carries over to obstructive sleep apnea. So type 2 diabetes is just, it's one that I always sit down as soon as a diabetic comes in. I let them know how important it is for us to kind of keep a tab on what their HbA1c is, and to make sure that that's kept in check, but also to look for the possibility of sleep apnea along with it, because we know treating sleep apnea can actually make it easier for them to control their blood sugar and control their type 2 diabetes. So,
Jeff, does taking once daily Jardians actually help that
I,
situation?
I can sing about it if you'd like.
I was just curious. Asking for a friend.
So many commercials.
So many commercials for those
So,
meds.
okay, boys,
Hmm.
we've established risk factors, and there's plenty more. I mean, you can make the argument people should be coming in for oral cancer screens, even if you don't have teeth, because 5% of Americans diagnosed with cancer or oral cancers, and a good percentage of those will die because a lot of them are fairly invasive and aggressive cancers. So, really important, whether you have teeth or not, that you're seeing a dentist on a regular basis for oral cancer screens, for sure. But how often should they go to the dentist?
I'm just gonna say, you just took my clothes away from me. I mean, that was not my clothes, my clothes for the show, but it varies from patient to patient. And I think that that is a decision that we make at the first visit. You hit the nail on the head earlier. My second patient in dental school was 55 years old, and I was the first, not even a fully licensed, but the first medical professional that the person had seen since they were born.
Uh-huh.
And honestly,
They
this
were
dude,
fine.
God bless him. He's probably still alive. This is
Yeah.
30 years ago. He's probably still alive today because he was so freaking healthy. The only thing wrong with him was that I went to dental school in San Antonio. People do weird things down there. They eat lemons. He sucked on lemons and ate lemons, and it was wearing the enamel off of his teeth. But damn it, it made his gums and his teeth healthy. I mean, his
Yeah.
teeth were so strong. I don't know if he's seen a dentist since, but that's the point that I want to make. It varies from individual to individual. And that's what we utilize all of the data that we collect. There's a reason we collect all that data. And I'm not just talking what you write down, it's what you write down, it's what we see, it's what we hear.
Yeah.
And it all of that goes up here, and we come up with a plan for you. Now, I'm not going to tell somebody, the most I'll probably tell somebody is once a year. I'm just going to be honest with you because I do think we need to keep tabs on it. They may laugh when they come back in a year, but there's a lot of people that we see every 3 months. There's a lot of people we see every 4 months. There's a lot of people we see every 6 months. There's a lot of people that I say, I want to reevaluate this situation in 2 weeks.
Yeah.
Yeah.
But
I,
that's
I
why
think,
you need to go. That's why
yeah.
you need to go.
Yeah, I think the longest under any circumstance, I would agree with that, that I tell anyone, hey, come back once a year. I think at the very least, we need an oral cancer screening. We need to
Mhm.
reevaluate the medical history. Um, and it's not that detailed. It doesn't even mean that we have to take x-rays every time. But I do think
Absolutely.
that a reevaluation at least once a year is critical. For people who are, moderate risk, middle of the road, maybe they're more along that 6 month schedule. But certainly there are a group of patients that need to be seen every 3 to 4 months, and some even more than that, depending on how fast they're building up plaque and biofilm, and what their ability is to maintain their own oral health and what their dietary habits are. And what I would say is, a lot of dentists have very full schedules with their hygienist. It's actually difficult for us to get help on the hygiene side right now. A lot of us have very full schedules on the hygiene side. The last thing we're wanting to do is tell every patient to come every couple of months. We really want you to come in when you need to be there based on your risk factors. And that's what makes us feel good. And it should make you as a patient feel good that, we're going to lay out which things we need to be looking at and when.
So, how often should a patient go to a dentist? Well, the first thing that I would say is build a relationship with the dentist. And if you feel like your dentist is ripping you off or scamming you, then you're in the wrong office and you're with the wrong person. And maybe we shouldn't be just choosing people off of our insurance network, but we should be looking for people we want to build long-term relationships with. Why are you laughing at me?
He's laughing at me because my glasses were crooked.
They are crooked. I've been.
Well, you let me do a whole show with crooked glasses?
Yeah.
No, it was just when you got excited. You got excited and things twisted, and then it was like you were
Yeah.
sorry.
It's okay. My point is, if you feel like your dentist is ripping you off or you shouldn't be here as often as you are, then you're not at the right practice and you're only going to them because they live a mile from your house or they're on your Delta dental plan. Find somebody who's your quarterback who will listen to what you have to say, who will read your medical health history, who will talk to you about sleep apnea and oral facial pain, who will do that oral cancer screen and walk you through that journey. And at the end of the day, it will be your quarterback when you need them to be, because life throws us lemons all the time. And unlike Chad's patient, we don't all get to make lemonade. If you have the right people on the bus, they will be ready to service you when the time is necessary. So, how often should I go? There's no magic answer to every patient, but having a relationship with an office who you can trust and having a relationship with a dental team who is going to be there for you when you need them is the investment that you're making for when that time comes. And ultimately, it always does for most people. They're going to be there, pick up the phone, and walk you through that very uncomfortable and sometimes painful experience to get you on the other side, just like Chad had that experience with that patient, and give them the most beautiful smile that they absolutely deserve to have with the right people on their team. That's my takeaway.
Love it. I think that's a mic drop.
Yeah.
Thanks for joining, everybody. Have a great night.
Hey,
that was a mic drop moment.
I'll just follow up and say this is that, when we first said we're going to have this conversation tonight, how often should everybody go to the dentist? I think if a patient watches this and they're going to be like, okay, well, I know the answer, 6 months. I don't need to listen to the podcast. And that's not the case. I mean,
Yeah.
that's what you need to find. If you haven't been to the dentist, when's the time to go? Tomorrow.
Now.
That's the time to go. Go tomorrow. Establish a relationship and find somebody that's going to suit your needs and just point blank ask, how often do you think I should come back? And let's see what they say.
And it's okay to ask what your risk factors are. Ask your dentist. Do you see any risk factors for me that would make it more important for me to be here more often? Are there things you need to evaluate more often? And I think most dentists are willing to have that conversation.
Absolutely. Absolutely.
Love it. Well, why don't we do this? Why don't we I think we call it a day right there. Thanks to our audience for listening, as always. And Chad, do you want to close us out on this segment? I think JB's got a news segment as well.
Well, I don't know if there's anything to close other than JB hit the nail on the head. If you don't have a dentist, please find one. And just find one that doesn't just care about these, but cares about this.
Mm-hmm.
they got to take into account the whole picture. There's reasons we take your blood pressure. There's reasons that we ask your height, your weight, your sleeping habits, your past dental history, your past surgical history, your past medical history. There's reasoning behind that because you don't just have 32 teeth. You have an entire oral cavity that tells us a lot about what's going on in the body, but more importantly, what's going on in your body tells us a lot about what's going on in your oral cavity and the problems that you may have. I can speak for us three. We take everything into consideration, not just right here. So find somebody that you trust. We're not trying to sell you anything. We're just trying to make you more aware of what's going on in your body and in your mouth. And so, with that being said, have a wonderful evening. Thank you for listening. And feel free to reach out if you have any questions. We'll answer them. Have a wonderful night, guys.
Good night.
Good night, everyone.
And that wraps up another podcast for Dentists in the Know. On behalf of Dr. Jennifer Bell, Dr. Chad Duplantis, and myself, remember that we've got a great profession, so let's make it a great day, Dinks.